Healthcare coverage is a hot topic. So is immigration. Combining the two leads to an uproar of opinions, with data often taking a backseat. In light of this, we're focusing on the results of a new study this week, examining whether offering healthcare coverage affects the rates of immigration. This is Healthcare Triage News. We hear again and again that providing healthcare to low-income immigrants would lead to an increase in immigration, resulting in significantly increased spending of taxpayer dollars. To the research! A new study out in JAMA Pediatrics examines this question by measuring immigration rates to states where public health insurance coverage was expanded to cover low-income, legal permanent residents, specifically kids not born in the United States and pregnant women. The theory, put forward by some, is that immigrants are likely to move from states that provide less coverage to states that provide more coverage, making the expansions much more expensive and resulting in more people who need to live off government support. But we can check. The authors outline previous work demonstrating higher rates of immigrant mobility within the United States when compared to U.S.-born citizens, mainly in response to the labor market. That initial settlement location of immigrants is associated with public benefits, and that demand for healthcare coverage is higher among immigrants because uninsured rates are higher among this population than among U.S.-born citizens. However, these data don't address the question of whether immigration rates increase in response to increased availability of benefits. In the current study, data were gathered from the American Community Survey between 2000 and 2016, which included data from all 50 states and the District of Columbia. The researchers then compared two groups. The first were people who might have gained coverage through an expansion. These included lawful permanent residents that were women of reproductive age and adults who have at least one child not born in the United States. The second group were people that wouldn't gain coverage from the expansion. These are basically adults who don't have kids. The main outcome of interest was immigration rates for these two groups, specifically looking at whether states with expanded coverage saw increased migration of eligible immigrants from other states. They did not. The annual move rate across the sample of over 208,000 immigrants was only 3%. Immigrants living in the United States as lawful permanent residents do not pull up roots and move their families across the country in order to take advantage of public benefits, even in response to big changes like a new baby. As the editorial on this study points out, most immigrants only look to the government for help reluctantly. Their focus is on their family and opportunities to provide for them, and in many cases on seeking refuge from life-threatening conflict or other circumstances in their home countries. Their focus is also on contributing to their new communities, and data show that they do. Over time, immigrants become instrumental to our economy via labor, business startups, and consumer spending. It's hard to move. People don't do it willy-nilly. Providing access to healthcare isn't likely to have a drastic impact on immigration patterns, but denying it, especially for non-evidence-based reasons, is very likely to have a negative impact both on the economy and, more importantly, on the health of human beings, which should matter at a fundamental level. Hey, did you enjoy this episode? It always helps if you like or subscribe down below, and you might also enjoy this other video on why the U.S. healthcare system needs immigrants. You might also consider going to patreon.com/healthcaretriage. Support the show as much as you like. We'd especially like to thank our Surgeon Admiral Sam and our research associate Joe Sevens.